Welcome to the checkup. I am Ginger Chris, the post acute care and staffing reporter for Modern Healthcare. Thank you so much for joining us. It's no secret that the COVID-19 pandemic exacerbated staffing shortages throughout the healthcare industry. Long hours and the strain of caring for patients with COVID-19 has led to burnout and mental health issues among providers. Employers have turned to staffing agencies to cover shifts and started offering sign on bonuses to attract new staff, but the problems persist. Wendy Horton, the Chief Executive Officer of the University of Virginia Medical Center in Charlottesville, Virginia, has developed innovative solutions to address workforce issues. Horton joined UVA in April 2020 as the Chief Operating Officer before becoming CEO in November of the same year. At the helm of the medical center, Horton earlier this year launched an Earn While You Learn program that allows pharmacy technicians and emergency medical technicians to train for their positions while still earning full time wages. She also has redesigned healthcare delivery to create a more sustainable workforce. Welcome to the checkup, Wendy.
Thank you. Thanks for having me.
We appreciate it. So, just to kick things off, I'm hoping, can you just kind of describe to us what the workforce challenges are that the COVID-19 pandemic created for your health system?
Yeah, for the University of Virginia, and I think across the nation, really healthcare was impacted substantially through the pandemic. Hundreds and hundreds of, individuals left healthcare altogether, and in many organizations, really left to critical staffing levels. And so, this has been a really amazing challenge for industry leaders to really know what to do now. I think that we were prepared for the pandemic, but then we weren't really focusing and thinking about the mental health of our workforce, and we went into the pandemic even a little bit behind, needing the staffing needs, and that just was perpetuated coming out of COVID.
When you say that you went into the pandemic behind, do you mean that workforce issues already existed prior to the pandemic?
Absolutely. Depending on the specialty, I think that we knew that there was shortage in many specialties, including nursing, going into the pandemic. That we didn't have the workforce that we needed. That there were shortages, and people were retiring, and we weren't replacing those or training as many people as we needed.
So, what kind of was your approach um, in kind of addressing this? I mean, what's been, I guess, your philosophy or your strategy?
Yeah, so being in Charlottesville, Virginia, it's not it's not in a really city environment, and so I think we had to think creatively on what we will do. And I would say it's a work in progress. I don't know that anyone has exactly all of the answers, but I think one day we came to the realization as a leadership team that even if we are the best recruiters, even if we are paying really top dollar for our team members, it's probably still won't be enough. And this was a hard realization of what do we do now, and sort of what do we do as an industry. And so, as a leadership team, we really talked about being one of the largest employers, and really had the responsibility of training, especially the support teams within our institution. And what that means is, how do we inspire the next generation? How do we really think about training and diversifying our workforce? And so, we spent a long time soul searching on what that might look like.
And that's an interesting kind of problem that you bring up. You were saying you've turned to all of these things that are, the standard of what you're supposed to do when you have these problems, and then to kind of be faced with the idea that that's not enough. Like that's kind of a scary proposition or a scary thing to kind of deal with. Um, I know that you've had some innovative approaches. Can you tell me about the Earn While You Learn program?
Yeah, so the Earn While You Learn program is really meant to meet people where they are. I think that we had this realization that individuals, when they think about healthcare, often they think of physicians or nurses or maybe pharmacists, but they don't think of all the vast roles that are available in healthcare. And a lot of these roles do not require formal university education. And so our real hope was, how do we meet people where they're at? We know that people have jobs and families and really complex life, and especially the stress of the pandemic. So how could we create a program where individuals had more of an apprenticeship model that they could come in, have full-time employment at fully benefited positions, and really have the support to earn on the job. And so these programs are amazing. They individuals, half a day is spent on the job training, and the other half of the day in a more didactic, traditional way. And for people that aren't, school type people, it's really working very, very well. And so we've had great success with the program, and we've launched, some mini cohorts through, and for others, we're kind of on our second cohort. So at various stages, but excited that we are continuing the journey in many areas, such as pharmacy technician, EMT, CMA, CNA, a variety of roles that we're trying with this approach.
Yeah, it sounds like you're definitely trying to break down that barrier into healthcare, which could be kind of, I don't know, like out of reach to some people, or you might not realize that's a career opportunity for you. And I know that you said too that you're extending this to some of those other positions like CNAs also. So that's an interesting way. Do you know? I know you said it's been successful. Kind of, how are you measuring success?
In a variety of ways, we're measuring success. First and foremost by the satisfaction of people. So how are people liking it? How are they doing in the programs? Are they able to complete the programs, complete the certification at the end? A lot of different milestones. But I think when you talk to the individuals, how are they liking it? How is it changing their life? Are they inspired? You can see it in their eyes. And for me, as a leader, that's really the amazing thing when you can talk to an individual, give them 4 or 5 choices, sit down and talk the difference between a phlebotomist and a pharmacy technician, and the pros and cons of each, and really help them get a career. And then as you're in the health system, that mentoring network is really built in, and there's tuition reimbursement and a lot of different paths, and they can really see a career ladder from here.
And do you see that actually helping address the workforce issues that you're facing?
Absolutely, absolutely. And one example is that our pharmacy technician program. So not only do we have an earn while you learn program, but we've also put in a career ladder where we have pharmacy tech 1, pharmacy tech 2, and so people can see all the way to pharmacy tech 4, and then you can be a lead, a manager, and so they can have this career progression all the way through if they want to go back to school to become a pharmacist or another a role in healthcare. So absolutely, people can see that pathway and that career progression for them.
Wonderful. So, something I know that you had mentioned to me before was that you've really been trying to address the workforce mix to try to address some of these staffing problems. Can you talk to me about how you've been maybe trying to use other positions to fill in where there are shortages in other areas?
Yeah. So one of the other things is even if we have more individuals, we know that probably we will never have enough, for example, nurses. And so in the height of the pandemic in our emergency departments, we were really in short supply of our nursing teams. And in that crisis, we were able to come together and think about innovation and what we will do differently. And I think as healthcare leaders, we really need to inspire and hold ourselves accountable to how will we redesign the care delivery model. In our emergency department, we're trying a couple of different models, but what we're trying right now is how do we what roles do we need to help support the team to do the work. And so in the height of COVID, we said if we don't have enough RNs for our emergency department, where do we go next? And so we talked about the patient types that are coming into our emergency room. We have a lot of mental health, and so now we have psych nurses, we have paramedics helping with airway work, we have EMTs, technicians, sitters, scribes. And so there's a variety of roles that are now in our emergency department that even 6, 9 months ago were not there. And so we believe that this is the future. There may be new roles that are developed to really help, and it will be more of a care team delivery moving forward.
Is this something that you think that other health systems could use as a model, or is this something you see being used in other health systems?
Absolutely. I think that we really, as health systems across the nation, what I love is that we share our ideas. And I think others are really thinking hard about how to do this. Another role that we're trying in our inpatients that we're just trialing the last couple of weeks is using kinesiology students of how to make our patients more mobile. And we believe that this role will help to take some of the pressure off of our patient care, our CNAs, and our RNs. And so we're excited to see we're piloting now, and we'll see how the outcomes turn out.
So from what we've been talking about, it definitely sounds like you're willing to try a lot of new things. You keep mentioning the word pilot. I know that that can be a scary thing for some people to just say, "Let's try something new." What's kind of been your approach in that regard in, trying to find these new solutions and, trying to be innovative and nimble?
Yeah. Well, I think when you have everything, it's hard. When you don't have what you need, then it's where the creativity really comes about. I think what's most important for leaders is how to do that safely and how to maintain quality. And so every time that we talk about doing something, we talk about the guardrails and the precautions and what we need to do be doing to maintain quality and safety, and also adhere to any legal requirements. And of course, you want to be compliant regulatorily as well.
At what point do you decide maybe something isn't working, or how do you make the call and say, "You know what, this just isn't the right thing to do. Let's try something else."
Yeah, I think we have many examples of that as well. So we've tried things for a day and they fail miserably. That's okay too. I think that's failing fast, if you will. I think we have a lot to learn in healthcare, trying technology, implementing new roles and new ways of doing things, and sometimes it's figuring out different ways to document, and maybe you don't even need all that documentation. And so I think right now is a perfect inflection point in healthcare to really try it and to do it differently. And it could be a model for the future. And I'm really hoping some of the things that we're doing here at UVA can help nationwide.
How do you see, I guess, how have you seen the initiatives that you've taken so far pay off? I know we mentioned the Earn While You Learn. Overall, kind of putting all these pilots together, have they addressed some of your workforce issues? And do you feel like maybe you have a more sustainable program going forward?
Yeah, I do. I firmly believe that people take pride in what they help to create. And so nothing that I've mentioned here today was my idea alone. It's an amazing team. It's the real front line that are actually front and center taking care of patients, and so that inspires hope when people can see that we're trying, we're innovating, we're doing things, we're pushing forward, we're modernizing. All of those things really inspire a lot of hope and a lot of excitement, and that's why we go into healthcare, is to really care for patients and to do things that will propel the industry forward.
So when you talk about hope or having, this maybe excitement for the future or these initiatives, is that something that you feel like maybe, um, I don't know, does that help in terms of burnout or some of those mental fatigue issues that, we see in healthcare, especially throughout the pandemic, with just the toll that doing this care has had on people? Like, does it affect that, or is it maybe like a separate thing?
Yeah, I think they are interrelated. I would say a large part of burnout can be system issues. And so, if we can make systems work more efficiently or take some of the barriers out of clinical care design, that really positively impacts burnout and also the toll and the exhaustion of working really hard. So always my goal is can we make it easier, can we make it more efficient, and can we do it better to take care of the patients and the families. And I don't know that we have the perfect recipe, but we are trying to innovate and improve each and every day.
Wonderful. Well, Wendy, this wraps up our checkup today, but I want to thank you so much for joining us and talking with our readers and subscribers. So thank you.
Thank you for having me.